What are the latest research advancements and future directions in managing graft-versus-host disease in acute myeloid leukemia patients?
So I think one of the things that's exciting about GVHD is that we're still in a phase where there's an explosion of knowledge trying to understand how people get this, who gets it, and again, ways that we can mitigate this before someone's ever put into the transplant unit. So one area that's a very active research is looking at our own microbiomes. There has been data linking that the type of actual intestinal bacteria that you carry can predict for whether or not you're going to end up with graft-versus-host disease, or whether or not when you end up with graft-versus-host disease, it's likely to respond to treatments or not. We are not yet at a place where everyone gets a stool test and we get there, but I think we will. I think we will find ways that are more in line with preparing people to prevent the disease from happening, which is very exciting. I do think there are also targeted therapies that are being investigated, and similar to AML by itself, I think GVHD, especially chronic GVHD, is not really one disease, it's a host of different diseases. And so we're starting to be able to do blood tests that look for which type of cytokines are deranged to point us in which direction we need to calm down the immune system. I think the fact that we might be able to have particular organs targeted for prevention of GVHD is also really exciting, because usually GVHD and GVL exist where if you reduce one, you lose the other. And so, as I said before, chronic graft-versus-host disease, a little bit of it is our tell that it's also being potent against the leukemia. And so standard, just give you some immune suppression for your GVHD does always raise the risk, or the worry, if you will, that the leukemia could come back. So I think novel strategies are being developed right now to try to attack this in organs, but maybe not in the bone marrow compartment. And those are things I really look forward to seeing what the results are.